I'd like to thank Getema and Medbeauty for the invitation. My name is Eliandre Palermo. I am a dermatologist and Mohs surgeon in Brazil. It's a pleasure to talk to you about a topic that I have dedicated myself a lot, the lip fillers. Lip fillers, a popular cosmetic procedure, can indeed create fuller and plumper lips. However, there is a common misconception that lip fillers always result in bulky or overdone lips. Do you know how to identify a filled lip from a natural lip? I asked this question on my Instagram last year and showed these lips. Most people got it wrong. And why is that? People associate lip filler with fuller lips. In this case, this patient was filled with EPTQ 300, in my opinion, one of the best hyaluronic acid on the market today for lips. To reach excellent and natural results, avoiding side effects, these are the key points: knowledge in anatomy, correct individualized assessment, planning, proper technique, and good products. The attractiveness of the lips is determined by a combination of proportion, definition, and volume. The ideal lips should be full with a well-defined vermilion border and a specific proportion between the upper and lower lips. According to Perkins and Sandel, the volume of the upper lip should be 75% to 80% of the volume of the lower lip. Attractive and proportionality lips have defined indices: a well-defined Cupid's bow in labial profile, a thinner protrusion of the upper lip in comparison to the large protrusion of the lower lip, and a filter with a specific height and shape. Other parameters to fully define lip aesthetic are filtrum height, upper vermilion height, ratio between the upper vermilion height, filtrum and upper vermilion heights, and the golden ratio between the upper and lower vermilion heights. The ideal dimension for the filtrum are 10 or 11 millimeters in width and 12 to 15 in length. In profile assessment, ideal lips proportions are determined by a measure the nasolabial angles and cephalometric lines, including nasal, subnasal, Steiner, and Ricketts lines. The Ricketts line connects pogonium to the midpoint of the columella between the subnasal and pronasal point. In a well-balanced face, the upper and lower lips should touch this line. In lips behind of the line are considered receding, and lips in front of the line are considered protruding. As we age, the filtrum becomes longer. The elongation and fending of the filtrum are recognized indicator of the lip and perioral aging. Lip anatomy. The layers of the lip are skin, subcutaneous tissue, muscle, orbicularis oris muscle, and submucosal layer, where the labial artery is often located. We have three surfaces on the lips: the labial mucosa, the vermilion portion, and the cutaneous portion. Just below the skin, there is a thin layer of subcutaneous tissue. The next layer is the orbicularis oris muscle, and in this case, the labial artery is in the intramuscular plane. The most common location of the labial artery was the submucosal plane, followed by intramuscular plane. Besides that, the perioral region is considered a moderate risk area. Arterial supply of the lips shows marked anatomical variation, even the size of the face of the same person. It is possible to know the real position of the superior or inferior labial artery? Yes, it is possible. Today, you can use ultrasound with Doppler to evaluate the lip and minimize risks in applications like this case. Portable ultrasound is more accessible today. Before treatment, you need to plan and answer these questions: where to apply, what technique, and which product. So, my team and I developed a new concept for injectable filler. This concept was presented in 2019 at the Master Injector Academy, an event entirely dedicated to injectable in Brazil. Sometimes the entire perioral region should be treated, including these areas: lip region, lip commissure, mental labial growth, and nasal growth. Where to apply? The injection on the lips can be done along the vermilion border, along the filtrum, in the body of the vermilion, and the subcutaneous, in the subcutaneous and submucosal layer. The rheological properties of the filler are essential to how it performs. To increase the volume, the filler must be able to resist degradation, maintaining shape and projection, and resist to distraction and compression forces created by a natural dynamic of the lips. EPTQ is a hyaluronic acid filler with three presentations, with high concentration of hyaluronic acid and lidocaine. EPTQ is a homogeneous gel with effective cross-linking and moderate to high cohesiveness. They have the same concentration but three different levels of cross-linking and lifting capacity. EPTQ has an excellent cohesiveness with a good tissue integration and the ability to retain the original shape when injected. Cohesiveness is created by internal adhesion force of all its units to each other. Together with the elasticity, it promotes the lifting effect. EPTQ can be used on different parts of the face, but the best products to use in lips are EPTQ 100 and 300. Technique. And now, what technique is better? We have different techniques for different indications. You can use a cannula or needle to create the contour of the lips. The injection can be made along the vermilion border by inserting the cannula or needle between the red lip and the white row. Most of the time I use 22 or 26 cannulas. In the following, you can see the very natural results. In this case, using only 0.6 millimeter of EPTQ 100 the lip contour. To obtain volume, the injection should be made into the body of the vermilion at the subcutaneous plane. It is important that the correction respects the natural curve of the lips in order to increase the volume without the risk of overcorrection. In young patients, the treatment of the lip usually involves increasing the volume of the central third of the vermilion body. For lip eversion, the product should be applied in a deep layer. Since this is a high risk area, cannulas are more appropriate to use. For eversion, the application can be performed in the submucosal plane with the entry point at the corner of the mouth, or another technique is to insert the cannula perpendicular to the lip in the central part of the tubercles with your finger, like this image. You can feel the dip of the cannula as it passes through the subcutaneous plane until it reaches the subcutaneous plane. In this case, I use EPTQ 300 in the lip and EPTQ 500 around the lips. After the procedure, observe the improvement And after the procedure, observe the improvement in the lip projection and the improvement in the labial angles, nasolabial angles. When we combine treatment in two plants, subcutaneous and submucosal, we have a great effect on improvement the nasolabial angle and the lip volume. And there are 3 tubercles on the upper lip and 2 tubercles on the lower lip. The treatment, the tubercles, is used for lip enhancement. Tubercles can be treated with cannulas for subcutaneous or intramuscular application, like this picture. To beautify and restore the shape of the lips, we must treat the tubercles. Observe this case in the improvement of the lips. In this case, we use a combined technique to correct the lip height, increase the volume, and treat the tubercles. In this case, we use EPTQ 100 in lips only to create a gloss effect. To increase the height on the lips, you can apply small vertical sticks very superficially. Look at the marking and increase the lip in the simulation. Observe the difference before and after this procedure using this technique. For this technique, I like to use EPTK 100 or 300 with a small syringe like the one used for botulinum toxin. Look at the video. The application is very, very superficially. How can I do this? I remove the back of the syringe and I insert the cannula, slowly injecting the gel without allowing bubbles to form. Immediately after the procedure, you can see enhancement of the cupid's bow, improved lip contour, and increased the vermilion height. In profile, you can see improvement of the nasolabial angle too. Each lip presents a unique challenge in terms of treatment, technique, and product selection. It's the right combination of proportion, definition, and volume that determines the beauty of the lips. Therefore, every type of lips can and should be treated. The secret to a successful lip treatment is naturalness. Thank you so much.